everyone. Thank you for being here today. You are at the Everyday Advocacy panel. We have a great lineup of speakers for you today. I know that we are up against a tough competitor for a session with GI, but I also am thrilled to hear that we are recording this session. So those who are not able to join us live, please know that we will have people watching, I'm sure lots of people watching at a later time. So I want to thank each of our presenters for being here. What we're going to do for this panel is we're going to have each of our speakers come up and speak individually, one at a time. You can ask them specific questions after their presentation, and then we'll move on to the next speaker. So I'm also going to introduce them one at a time. 3 of them are in the room, and we will have one virtually as well. So I think that our first speaker needs no introduction and is probably very well known within the community, but I am so pleased that I get the chance to introduce Janet Wilson. She is a multidisciplinary trained coordinator in disability concerns. Janet's personal experience in raising her daughter with Phelan-McDermid syndrome has fueled her passion to empower other caregivers with knowledge to thrive and grow. So I really know that she's going to give a great presentation, and hopefully you all will have a lot of questions she can answer at the end. Thank you, Janet, for being here.
Thank you, guys. So when we were asked to put this together, there's so many different ways to advocate. So we're all going to speak on what we know best and what we've had more experience with, per se, and the ways to advocate are so varied. Sometimes you stumble into an opportunity to advocate, and whether it be for advocating for your child as a child with Phelan-McDermid syndrome or just a child with some uniqueness, it's always a good idea to try to have conversations with the communities and the people you encounter on a day-to-day basis, to give them life experiences and to help them be more aware of that there are many people out there with uniquenesses. There's so many different rare diseases in the communities, and so we're just one small part of that rare disease community, and advocacy is a good thing for us. So I'm going to speak on a lot of different things that I do. I work for University of Oklahoma Health Sciences Center and Department of Developmental Pediatrics in a group called Sooner Success, and we help out families with disabilities find and access resources in our state. And through that, and through Alyssa, I've come in touch with a lot of different opportunities in my life, and it's fun. I'm always feeling happiest and most fulfilled when I can help another family get knowledge and feel stronger to advocate for their own child. So this is Alyssa. This is my daughter. She is 35 years old, cognitively about 4 years old. She has a 43 kb deletion, and it is interstitial exons 10 through 24 of SHANK3. Yeah, I don't really understand a whole lot of what that means. I just know that she has some cool stuff going on herself. One of the newest things that we've done here, we've done in Oklahoma, and it can be very easily duplicated in your home states, absolutely, is we have formed also a group called Oklahoma Rare. So you could have Texas Rare, you could have Kansas Rare, you could have Minnesota Rare. And it is a group of families that have rare diseases, and we've come together to help advocate at the state, local, and government level, because Oklahoma has some shortfalls where it comes to services, and so we're helping to advocate. One of the things we're doing is called Tell Your Story. There we go. And so we're putting together a booklet, and each family that submits their information they'll have the page like here is on the right side, which is ours is the Wilson family. And I talk about Alyssa, I talk about how having a child with a disability and a rare disease has impacted us as a family and financially, because legislators, they always want to know the bottom line. They always want to know how it impacts you and the state financially. And then we talk about how long it took for our diagnostic journey, which was 18 years. On the other side, on the left side, is a page that will be inside this booklet, and it's called the Oklahoma Rare Disease Impact. And we looked up statistics about what the financial burden is on the state of Oklahoma and on families. That's a big thing for legislators and those that fund different things. They want to know what is the financial impact. So we're putting together a whole bunch of pages with the families, all the different families. We have this page, and then we are attempting, 22 states have so far, but we are attempting to form what they call a Rare Disease Advisory Council. And that will be at the state level. It will be legislators, it will be medical doctors, it will be some family members to help push forward legislation and funding and stuff like that for families that have rare diseases. There are so many rare diseases that we just don't realize that it is a rare disease. So it's a cool new concept that we've just been working on the last 6-8 months. My really good friend Sky Collins, whose daughter has Milan syndrome, has done all the graphic work. Yay for her, because I'm not tech savvy. I'm doing good trying to get the clicker to work. Please, there we go. I think everybody in here probably knows about the October 22nd, which is our International Awareness Day. Shine Green. If you've seen some of the old photos, there's one that when they were advertising for Shine Green was this, which is the Myriad Gardens in Oklahoma City. They have this really cool indoor green space, and it is all covered by a round dilly of glass, and they shine it up at different colors, and so they shined it green. The other picture is one of our years that we went to our other lighted landmark in Oklahoma City, which is the Skydance Bridge, or Scissortail Bridge. And it's a gigantic sculpture that's supposed to represent or resemble a scissortail flycatcher. And so I've petitioned both of those every year to light it up green, and they will be again this year for October 22nd. So if you're living, wherever you live, if there's any local landmarks, buildings that are lit up at night, see how you can find out if you can possibly get them to light it up green for October 22nd. That's our day. And go take pictures and post them. It's always a cool thing. Along with the Shine Green, we've done petitions for a proclamation, the Phelan-McDermid Syndrome Awareness Day proclamation. And this was the year that we got it, and this was Governor Stitt, which is our current governor, the Sutton family, which is Brooke and Alex. They both have PMS, twins with PMS. Woo, yeah. And Alyssa and me, of course, and baby. Alyssa has baby. I actually have the really cutest photo of Governor Stitt holding baby all on his own. It's really cute. So, and that's Alyssa in front of the state capitol with the proclamation. And then the next year, I took it and did a petition for our local city, Mustang. And so they did it. It is in perpetuity. So from October 22nd till the end of time in Mustang, our little hometown, will be Phelan-McDermid Syndrome Awareness Day. Just so happens that the mayor has a sister who has another rare syndrome, so I kind of had it in, yeah, a little bit, but we'll take it. And I guess y'all can tell when that was during COVID. And of course, along with all the other stuff that I do is NORD. I am the Oklahoma State Ambassador for Rare Diseases. If you are not part of the Rare Action Network, please go to that. Please do put in Rare Action Network. Every state has a Rare Action Network. Every state has, well, maybe not all states currently have a state ambassador, but maybe one of you could be a state ambassador for your state. It's great to connect with other families with rare diseases. It's great for advocacy. You get to do some really cool stuff. The National Organization of Rare Disorders, they are a great group to help collaborate with on different things. And they have what they call the state report card, which is really good to get every year and print off and talk with people, talk with your legislators about this is what we see our shortfalls in our state when it concerns our rare disease families. And so they also do a lot of work with Rare Disease Day along with Global Genes and Every Life Foundation and RDLA, which is Rare Disease Legislative Advocacy. There's so many different groups that you can be a part of, that you can go in and out of, whatever suits you best, whatever you feel your strongest advocacy, type is. There's always something that you can do. Even if you just, go stand in the entrance to Walmart and say, hey, can I talk to you about something? Or wearing the Feeling Lucky shirt, or wearing our other shirts, and somebody comes up to you, just have a conversation with them. Anytime we can always raise more awareness or talk with families, it's always a good thing. And this was the Rare Disease Day that I had. Well, we've had a few of them. So this one, shortly before I took over the Rare Ambassador helm at Oklahoma, I helped out with them and volunteered and did them in an unofficial capacity. This was my one of our state senators, Paul Racino, and this was his first year in the office, and it was maybe 6 months after he'd got in, and when he first became senator, I had a conversation with him. At that time, his grandson had just been diagnosed with autism, and so he didn't really have a whole lot of experience with any type of uniqueness in children or whatever. But I kept on talking to him, and so he helped me organize the Rare Disease Day event at the state capitol, and he became a huge lover of Alyssa, and so this was a really cute photo. He came down to our event and squatted down and talked with her, and that's really cool. A bigwig, and he takes the time and he takes the understanding to get down on, squat down and have a conversation with Alyssa. That's impactful. He has gone on through our advocacy efforts from a lot of us. He's gone on to help champion one of the largest appropriations for Medicaid waivers in Oklahoma to date, and that was done in 2022. We went from about 8,000 on our wait list down to currently 2,000. It was a really good thing. My daughter waited 12 and a half years for a waiver, so it's rough for a lot of people, and it was rough for us, but people like him that you can impact, it really does a good thing. The top photo is a bunch of the families got together and we took a picture, of course, and then the last one we did was more of like a resource fair day. So we had all different types of agencies and organizations host tables with information that they were groups and organizations that may help out a family with a rare disease in some way or across the state. And then we had families come in, and that was really cool. That was done at a local children's hospital. There we go. And then my last one is another unique thing I do is a lot of universities have medical centers or have medical colleges, and so they will always have medical students. So they have something called first-year medical clinical correlations, and so at the University of Oklahoma Health Sciences Center, and I did this before I got the job there. I did this I've been doing it for 11 years now. Our genetics doctor, Dr. John Mulvihill, and his assistant, genetics counselor Ashley Taylor, asked if we would speak to first-year medical students and tell them about our life Phelan-McDermid syndrome, how it affects our family life, how it affects Alyssa. I come to that table with all these first-year medical students every year, and I tell them right off the bat, nothing is off the table. You can ask me any question, because if I know that doctor at some point may encounter another child with a rare disease, or I want them to have every bit of information they can have possible to understand just how difficult this life can be sometimes, and that they need to realize that there is a family behind that diagnosis. And, there we go. And so we absolutely love this. Ashley Taylor, the genetics counselor, about 6 years or so ago, there was an opportunity to submit a story to Genome Magazine for a book they were producing called The Code Talkers. And what it is you're sharing your story about your genetic journey and how your relationship with your genetics counselor doctor has impacted your life. And so I submitted a story, and we got into the book. So they came out and took pictures and everything. So there's always little bitty different little avenues and opportunities that you can have to advocate. There's a bunch more I have, but I know we're really busy. If there's any families in Oklahoma, Bobby, or Arkansas, is any Arkansas here yet? Nope. NORD is actually going to do 2 advocacy trainings, but you can contact NORD and ask them to have an advocacy training in your state, and they will come out, they will help organize it, and they will train and let families, all different families with rare diseases, know about how to advocate. So that's all I got. Thanks.
Thank you, Janet. At the foundation, we always call Janet our super advocate, so we so appreciate all that she does on behalf of everyone's loved ones. We're going to take a moment and take 1 or 2 questions specifically for Janet. We are going to bring you a microphone, so raise your hand if you have a question, and we'll bring you a microphone because, again, this is being recorded, so we want to make sure we can capture any questions. So anybody have any questions for Janet specifically? Now would be the time to raise your hand, and I'm sure she'll be happy to answer it. I have no takers at the moment, but we will also see at the end if maybe you had a moment to think of something.
I think I vomited nothing.
Okay, we'll move on to our next dynamic speaker, and we have Chrissy Hood. She is a tireless advocate and a mother also of a child with Phelan-McDermid syndrome. Chrissy's efforts in raising awareness and advocating for better support and resources have made a lasting impact on so many families, and I'm just thrilled that she's here to talk a little bit about her experiences today. So please join me in welcoming Chrissy.
So I'm going to throw a lot of information at you really fast with a lot of photos. I am very much a visual person, and I love to take photos. So I'm going to share our advocacy journey for adult changing tables. This is our daughter, Elena. And so we're going to talk about adult changing tables, but also how you can use the advocacy kind of way to do things. Out to our home and just kind of did a video on our story. And this was used to share with our legislators, to share all over honestly, the United States and probably further, just about the need for adult changing tables and why it was so important to our family. And we realized that videos kind of tug at those heartstrings and can sometimes play on the emotions a little more than me just standing up here talking. Okay.
Elena is always happy. She's almost always smiling. She loves going.
daily care, for changing your clothes, for toileting, for feeding. We have to comb our hair, brush your teeth. Do you want to go?
Go.
All right, let's go. Come on. For someone like Elena, having a location to change her, our only option at this point is to lay her in a dirty bathroom floor. That exposes her because you can see under the stalls. Once they outgrow the baby changing tables, that is our only option. So we spend a lot of time driving around parking lots, finding that area where we can turn the van away and where there aren't people passing by that can see her, because she is 18 years old and we do want to respect her privacy and keep her dignity and not expose her. I began speaking with our church, different ball fields and things where Elena would go, just letting them know that we had that need. But once I joined the council, things really started to change and take shape. After my orientation, I sat down with Lauren and I expressed the need for adult-sized changing tables, and it wasn't something that she didn't care about. It was just something that was not on her radar and that she had never thought about. And so she began walking me through the process of how do we work towards getting a bill introduced, how do we find a sponsor, and how does the process work?
We're designed so that our council members who are citizens and experience disability in their daily life outnumber the staff. So we are there guided by them. I'm the public policy director. I can help her navigate the legislative process. I can help get meetings with legislators and make introductions, and I can lend capacity when we have a dozen meetings we need to make before a committee meeting, for example. However, Chrissy is the expert. She can answer the questions that I can't answer because I've not lived it like she has. Probably the most important thing the council does is we give a platform to people like Chrissy that she may not have felt that she had before.
There was a lot I didn't understand about policy and legislation, and I felt a little inadequate. I think I've gained more confidence in my story, in sharing our story, so that others can understand what our life is like, and honestly what the lives of other individuals and other families who have a loved one with a disability, what they might be going through.
It's intimidating to take that first step. One way to take the first step is to go to our website. We can connect you with people in your community who are ready to walk with you.
It just takes everyday people speaking up, sharing their stories to make change. And I didn't think I could do it. Along the way, so many times I have doubted myself, but just share your story, because no one lives your life.
So the problem for us was that Elena had outgrown baby changing tables, as you can see. She's not going to fit on that, so our options are to lay her on the floor. We pull our van into an area and we change her in the floorboard. That was what we were left with. So what is the solution? Powered, height-adjustable, adult-size changing tables. There are examples there of powered, height-adjustable, adult-size changing tables. Some of them fasten to the wall, some of them are freestanding, but the idea is that they are powered, height-adjustable, and they're larger. So why powered, height-adjustable, adult-size changing tables? So as you can see, the one on the far right is a photo of Elena standing next to a fixed height table. Elena is ambulatory. She is not a wheelchair user, but I cannot pick up Elena and put her on that table. She's not a large child. Or adult, I'm sorry, she's 21, and she cannot boost herself up on that table. So a powered height adjustable table will lower down so that she can sit down and for easy transfer from a wheelchair, and then it raises up for the caregiver, because let's face it, I'm going to be changing her for the rest of her life or the rest of my life, so I need to preserve my body. So how we got started, I joined the Council on Developmental Disabilities. And at my orientation, I went and talked with Lauren and explained the need, and she was like, I never would have thought of that. Well, if we don't live it, we do not think about it. So we started with going to our Disability Day on the Hill. Typically, every state has a Disability Day on the Hill where all the disability advocates go to the Hill and they meet with their legislators and they talk to them. I was encouraged to do a one-pager about Elena. We call her Elena Bug, so everything's ladybug theme, even to what she wore that day. So we tried to match, because if we're cute, we look a little more.
But that just told her likes and her dislikes, so that when they look at Elena, they see a human, someone that's like their child, someone that's like their niece or nephew. She has likes and dislikes just like anyone else does. She may not be able to always express them, but she does have them. So we met with our House of Representative Clay Doggett, and we met with our Senator Joey Hensley, and talked with them and explained our need. And they were both like, wow, I never knew anything about that. So Clay, Representative Doggett, his wife is a nurse practitioner, and when he went home and talked to her about it, she was like, that's a no-brainer. You've got to do something about this. So the first thing we had to do was educate others. How many of you had ever thought about a powered height-adjustable adult-size changing table before today? Yeah, some of you live it, some of you know it, but for others it may not be something you live. So we started with, and this was the suggestion of one of the legislators in another part of the state, billboards. Adult-sized changing table, because everyone deserves dignity. I run the Changing Spaces campaign for Tennessee, and I end every post I have with that phrase, because everyone deserves dignity. Would you want to lay on a bathroom floor? Would you want to lay your child, your mother, your father, anyone on the bathroom floor? So, and we shared with news stations. We had a lot of news coverage. They came out and did things. The Council on Developmental Disabilities did the billboards, did the video. They also did some articles. I spoke with my county, my city council, and they did an article, unless you live it, you don't know it. You don't think about it. The Tennessean, we had different people write op-eds. The Tennessean is our largest paper in Tennessee. And so service providers, families, friends, all these different people wrote op-eds and just shared why this is important. And then, of course, there were also, just print articles and things. I'm sorry. So how we shared our story, I shared some of that, but also we worked with one of the biggest things that happened was that the Adventure Science Center in Nashville decided they wanted to put in a table. And AmeriGroup, which was one of our Medicaid companies, they helped sponsor it, and Max Ability donated a table. And so they put it in, they asked us to come to the ribbon cutting. My state representative came, he spoke, and it was a whole big ordeal, and News Channel 5 covered it, and it went everywhere, and it just blew up massively. Now, I told you I spoke with our city council. So this one over here, this is Marshall the duck. And when they shipped Marshall to me for promotions through the Tennessee Disability Coalition, he would not fit in my door. He came in this massive box. So we carried Marshall everywhere, and we did a kind of a story on social media about Marshall and about our experience. So our city renovated an entire restroom and put in the adult changing table, and then our county courthouse annex put in one as well. And they're two totally different tables. One just you reach under and do it, and the other actually has the remote that does it. So finally, we had a bill sponsor. So we have Representative Doggett signed on as our sponsor, and then Senator Watson, which was across the state, he signed on as our bill sponsor as well. And the reason he signed on was one of my council members that is on the Diddy Council with me. He walked into a restroom in downtown Chattanooga and saw a 35-year-old man being changed on the restroom floor. And he said that this is not going to happen. He has a son with autism who does not have that need, but he spoke up for him. And he went to bat, and he got our legislator who came in and partnered beside us. And that's Roddy in the bottom. He likes to pick on me a lot, but Roddy was amazing. And he had been through, every state has partners in policymaking. Please sign up for partners in policymaking. It is a long course that takes place like less than a year, but you will learn so much about advocacy and navigating all the different systems in your state. So those were pictures of us testifying during COVID. So, Roddy told me, compromise is important. Well, I'm stubborn. And I want it my way and my way only. So what was I willing to compromise on? I was not going to compromise on the fact that it had to be a powered, height-adjustable, adult-sized changing table. Because like I showed you in the other picture, she can't get up on that fixed height, and I can't get her on it, and I'm tired of changing my baby in the floor. So I'm not willing to compromise on it being a single occupancy restroom, because I am not always with her. Her dad's with her sometimes. And he can't take her in the women's restroom, and he doesn't want to take her in the men's restroom. And they need privacy. Like I said, Roddy saw this 35-year-old man laying on the floor, completely exposed. But I was willing to compromise. Does it have to be a bill with a mandate? Or can we look at other avenues? I'll compromise there. So we compromised with a grant program, and our Tennessee Department of Environmental Conservation, which is our state parks, and TDOT, which is our Department of Transportation in Tennessee, they were included in our grant. So we came up and we said, okay, we want a grant with $500,000 so that businesses and places can get $5,000 to install a table. TDEC's going to put them in all of our state parks, and TDOT's going to put them in all of our welcome centers and rest stops. So we developed another one-pager. One-pagers are these amazing things that you can leave everywhere. I'm going to go back one more. Sorry. No, that was right. All right, so we developed the one-pager about what is the need, what is the solution, so that families or businesses more so knew what to do. We went and testified again in front of the House with our representative there with us. Now, even before we changed over to not having a mandate and just doing a grant, it passed through every single committee unanimously. Republicans, Democrats, they didn't care. They all said, yes, this is a need. Yes, we're behind this. Yes, we're behind this. But our fiscal note was going to kill us. So that's why we switched over and did the grant more so. So your relationships are so important. The relationship that we have with our state representative is phenomenal. I remember Roddy telling me that you should be able to go sit down and have coffee with your representative outside of session. And your legislators, not just your representative. So we're standing outside the day they voted on our bill, and we were recognized from the House floor by our state representative. And we had success. So, I'm going to let you do this. I am so sorry. We had success. So we met with our governor. This is Elena shaking Governor Lee's hand. He was phenomenal with her. We had our bill signed, which ended up being more of a House joint resolution saying that TDEC would put them in our state parks. Let me just tell you, Tennessee state parks are on the goal of being the most accessible state parks in the nation, and they are on fire. I am so proud of my state. We have the all-terrain wheelchairs. We have adult changing tables, and there is a contest called Centus Best Restrooms in America, and our Natchez Trace restroom with the adult changing table is in the top 10, so you can vote daily for that. I'm just going to throw that out there and give us a plug. So our celebrations, we were asked to speak at the groundbreaking at TDOT for the first Welcome Center and Rest Stop that took place in Chattanooga area, and there's Elena standing next to that table, and then, of course, we had to wear our PMS shirt, our Feeling Lucky shirt. So we also were on the Kentucky line at another Welcome Center where they had an adult changing table. So advocacy and education continues. We have this grant. Oh, by the way, they didn't give us the $500,000. They came back and said, we'll give you $1 million. We were blown away. Yes. So we had to continue to advocate. So the council flew me out to DC and said, we want you to go to the AUCD conference. We want you to talk to people about this. We want you to meet with Walmart Corporate and let them know of the need. Walmart Corporate, yeah, we never heard back from them. But I did get to meet with my legislators, Marsha Blackburn and Bill Haggerty. And then we also had the opening of the Welcome Center. TDOT did some more stories on us. I've spoken to the LEND program at UT Health Science in Memphis, gone again to the Capitol. We've done different things, spoke at the Rural Health Association conference, different things like that. I'm running over, aren't I? I'm so sorry. So anyway, your advocacy, we had to do more legislation because we don't have family restrooms. So this is the victory where it all started. So when we went to Disability Day on the Hill this year, they asked Elena to cut the ribbon for the new adult changing table in our legislative buildings, which is part of our Capitol. So it passed, and my favorite picture, Elena is at the very top where this unanimously passed to increase from 5,000 to 10,000. Changing Spaces Tennessee is what I run. There is also a Changing Spaces Awareness Day, July 26th, which is also the signing of the American Disability Act. We have a map that shows every changing table in the United States. So if you're traveling on the way back home and you need a changing table, hit that QR code and it takes you to Changing Spaces. We have chapters all over the United States. Get plugged in with your chapter. So we are changing lives one table at a time because everyone deserves dignity.
Thank you, Chrissy. She's really, truly amazing, and I think she's a testimony to if there's a will, there's a way. And so I think that Chrissy says it best, that she didn't come into this thinking that she was capable of it, and look how much she's done. So phenomenal. We have time for probably one question, and again, please raise your hand and we'll bring you the microphone because we want to make sure it's recorded. I think you covered it also brilliantly, so thank you for that. Our next presenter is Laraleigh Windom. She sadly could not be with us in person, but I'm delighted that she's joining us by Zoom. So let's please give her a welcome. She's an influential advocate and mother of a child with Phelan-McDermid syndrome. Do you see a pattern here that we have a lot of moms who are doing this advocacy work? Lauraleigh's dedication to advocacy has driven her to make meaningful changes in her community, empowering other parents and families along the way. We've had some difficulties with Zoom today in this room, but I think we've ironed it out. But so please give a warm welcome to Laraleigh. Thank you.
Hi, everybody. So, first of all, I want to say thanks to all of the other advocates who have presented already, and I know we have one more after me. It is because of people like you that I decided to try and do something different. I want to tell you a little bit about my son briefly, and then I'll give you some tips that are a little bit more personal to your own journeys and maybe gathering and gaining access to things that you might need that you're being denied. So my son Lou is 17, he'll be 18 in September, and we didn't get a diagnosis until he was 13 after he had a major regressive episode. And from there, he went into it was just a whirlwind of things that were happening. And I would call our disabilities, our disabilities and say, I need help. And they would say, oh, we don't pay for anything like what you're asking for. And then I would call our insurance, it's a Medicaid program, and I would say, I need help. And they would say, sorry, but we don't pay for that stuff. And so from there, I kind of had to claw my way up a mountain and gather up more information to prove that you have a responsibility and my son does have a right to the thing his doctors were determining were medically necessary for him. And so the federal mandate that supported that is known as EPSDT, which is early screening, diagnosis, and treatment. And basically what it is was in 1967, 2 years after Medicaid, can you hear me? Okay. 2 years after Medicaid was established by Congress, an amendment was added to include EPSDT. This was the first entitlement to child health services established in the states. So what does this mean? This is basically a mandate that says, hey, we're gonna pay attention. We're gonna do assessments. So you guys probably have done like the autism assessments in your pediatric office. They've checked hearing, they've checked vision, those sorts of things. So we're gonna do those early and we're gonna do those screenings completely. We're going to obtain a diagnosis and we're going to support treatments. All right. So this is something that happens in every pediatric office in the country. So what this means as an advocacy tool, right, is because you go to a pediatrician and do this stuff and they say, oh, your child has this hearing loss or they have this diagnosis of autism or whatever. And then they say, you need X treatment, right? So in our case, my son needed ABA. Didn't need the standard ABA. He needed a lot of ABA. And so we went to a AMER group and they said that the doctor said he needs ABA. And they said, okay, he can have 15 hours a week. And so we went to a BCBA who did an evaluation and she said, I think he needs something more like 24 hours a day. And the state said, that's funny. We don't pay for that. And AMER group, which was our CM, said, we have a contract where we basically excluded out things like support services in the home. And so that's why we can't for our ABA. You can have 40 hours. And because of this, providers like BCBAs, occupational therapists, speech therapists, everybody, they hear from their CMO like, oh, you get 40 hours. So what do? They write all of their orders for 40 hours. And this creates a ripple effect where providers will only ask for what the CMO says they'll pay instead of what's actually medically necessary. So EPSDT actually overrides those plan limitations. So AmeriGroup can say, we don't pay for that, and we've excluded it from our contract with your state. But that's not actually the case. They're legally obligated to pay for it. And so you have to find yourself a provider who's willing to say, no, this patient qualifies for, and it is medically necessary for this patient to have these extra hours, or this type of care, or this. The providers will say, we don't pay that, right? The payers will say, we don't pay for that. Well, if you get a provider who's willing to go to bat for you, and according to EPSDT, you do, they usually back down. So just be educating our providers, everybody, to ask for what is medically necessary and to stop bending to what insurance will pay for. That is not how we take care of people in our society, and our children shouldn't be limited to what insurance has decided is the most appropriate treatment, especially for our disease like Phelan-McDermid syndrome. But they have absolutely no documentation to support what they're saying is the most appropriate treatment. So EPSDT is the mandate that supports better coverage options, more hours, and even support. To give you an idea that's impacted us, my son spent a year and a half in a psychiatric facility, and during that time, we battled out with our CMO, AmeriGroup, our Medicaid CMO, and we required them to not only approve for him to have 2 RBTs 24 hours a day when he got home from the facility, but for them to find a provider and for them to continually communicate with the provider to make sure the provider was meeting the needs of my son. So he's been home now for almost 2 years, and it's been amazing to have such support. And to give you an idea of how impactful that's been for him, when he went into the facility, he couldn't speak. He was no longer potty trained. He had such a huge regression that we just didn't know what we were going to get back. And now, a couple of months before his 18th birthday, he has a part-time job at the Dollar Tree. He has a full life. He participates in all types of activities. He volunteers. His verbal skills are still kind of low, but he's learned a lot of new skills because he has continual programming every day available to him and the right kind of support, which was medically necessary for him to make progress. So here is how EPSDT impacts care. One, it solidifies that mandatory coverage. If it is deemed medically necessary, it's got to be covered by Medicaid. Medicaid doesn't get to decide if it's medically necessary. They may argue push back, and sometimes you do have to compromise a little bit, but they are not the end-all solution. When you come with support, when you come with extra information, a lot of times you can prove that what you're asking for is the most appropriate thing. They also have to provide you with case management. So that means not only do they have to cover the service, but they also got to help you find somebody to perform the service. So if you have a special case, like we have a special case, we had to find a provider who was willing to hire RBTs who would work nights and weekends. There is federal backing for EPSDT. It is a federal, and the states must meet the minimum standard here. So we have to start holding our states accountable for that. And then this will continue until your child turns 21. So they're entitled to all of those services until their 21st birthday, at which point they'll transition into the adult care system. All right, so what does medically necessary mean? So medically necessary treatment must either prevent a condition, so like a lab testing to determine, hey, I'm vitamin D deficient, and if I don't get some vitamin D treatment, I'm going to run into issues later on. So that's an example of that. It must improve or ameliorate or lessen the impact of a condition, and that's what the ADA does for my son. His condition was pretty much unmanageable in our home, why he spent a year and a half in a facility while we were trying to get services sorted for him. And so the ADA has lessened the impact that this has on his ability to function and to lead a full life and to live in our. And then the other option is for it to restore or cure a condition. So like if you had one leg shorter than the other and you needed a prosthetic, that's something also that must be covered and is medically necessary. All right, so how to advocate. First thing that you got to do is you got to find the right provider. So if your pediatrician says, oh, I think your kiddo could utilize some occupational therapy to have better skills or to do X, Y, and Z better, right? You're going to go and you're going to do those evaluations. You're going to tell evaluation, you're paying to fight for what is necessary. You want them to write that report as if the sky is the limit. You want them to say, this is what we want. So really push for that because, like I said, they're looking to get you something, and what you're fighting for is everything. Right? And then you're going to read up on recommended treatment options, syndrome and condition. So Lou's been through a lot of different treatments because of the nature of his Phelan-McDermid syndrome and then also his other health concerns. And so when I come into the doctor's office, and especially when I have to talk to the insurance company, I'm list documentation. I say, oh, well, here's the from, 2006 where this and this and this happened, and it was positive progress. So it's not really experimental at this point. It's just not being utilized. So you can definitely reach out to, the foundation, I'm sure, has tons and tons. I mean, I know they do. They have tons of research to tell you what is and what is our recommendations for treatment and that sort of thing. But for any other symptoms or experiences or diagnoses that your children are having, definitely start pooling together any documentation that supports what you think is the most appropriate. Because despite the fact that we see all these providers, in the end, for Lou especially, my kiddo, and I'm sure for yours, at the end of the day, I know what he needs in order to live in my home. I know what he needs in order to function and to get the things that he needs to have that full, fulfilling life, and for his siblings to be able to live here as well. And then persist. Don't ever minimize. Always show the most true picture of what is happening in your home, what is happening with your child. Take data. This was something that really helped me a lot. I just made a spreadsheet and said, okay, here are all the behaviors that we're experiencing. Here's the dates that these behaviors occur. And what kind of correlations can I draw from this? And for Lou, what I drew from that was that he had manic episodes that could be timed monthly. And I could say, oh, but here we go. We're going to have 3 good days and then it's going to be really bad. And it really was to the point. But make the experience real. Not just for your insurance company, not just for Medicaid, not just for your Department of Community Health, not just for your providers. Make that experience real for every single person that you ever have to tell this story to, right? Remind them who your child is. Remind them of the good things that they used to do before they started struggling, or the things that they're capable of if they could just get a little bit of extra help. So here are some services that are covered by EPSDT. All those screenings we talked about that you have in the pediatric office, that's part of Bright Futures. Your dental, your vision, hearing, diagnostic testing, treatments, non-emergency transport. Before Lou went into the facility, we had to drive down to Atlanta, which is about 40 miles from us, every day for this severe behavior program that they wanted him to participate in before they would go to the next step, the next level of care. And so I said, okay, we'll go every day, but I want somebody to pick us up and I want somebody to bring us home because I need to be working during that time, and I will work remotely while doing that. And so that's one of the things that they do. They'll also schedule appointments for you. So if you find that you're a busy mom or a busy dad, and I know that everybody out here is, and you're like, you know what, I don't have time to chase this down. It's your job to do it. Let them do it. That's what case management is for, and it's important. I'm also a nurse, so I really, really put the onus back on the insurance company or back on Medicaid to do what's required by them because they're paying nurses to do that work. And those are my colleagues. I want them to be valuable and beneficial, and have those. I also know that's a federal requirement, so why not? All right, so unlike private insurance, Medicaid programs must tell you about EPSDT and help those services that are covered under it and cover those services. So if you have never heard of EPSDT and you've received a denial about occupational therapy and you're wondering well, if I'd known this was a thing, I would have fought harder. That's to bring up. When you go to your OT provider and you say, look, when we do our reeval, let's really go for the gold here. Let's try to find exactly what would benefit our child, right? And we're going to submit the report to that. And they say, oh, well, insurance is only going to cover this much. No, that's fine. I want to talk to insurance, right? And you call and you ask for case management. You say, my child has a rare syndrome, or my child has a developmental delay, or whatever you're dealing with. You say,
Thank you, Laraleigh. We really appreciate it. So again, if anyone has any questions, now would be the time to raise your hand. Okay, we have a question in the back, so we'll bring you the microphone.
Okay, perfect.
Hi, I just quickly was wondering, is this a waiver?
No, it is not a waiver. EPSDT is basically for the pediatric population, so anyone under the age of 21, you do not have to apply for it. If your child has any form of Medicaid, they are eligible to receive support under this EPSDT mandate.
But how come when you Google it automatically says waiver? Is it just like is it just because kids qualify on waivers for, like my son's on a waiver for Medi-Cal, you know? So is that why it's confusing? In some states it looks like a waiver?
Because they attach it to Medicaid, and a lot of times Medicaid does come in the form of waivers. So you'll see a lot of information about that, like, oh, it's, you know, this is your waiver that you have your Medicaid through, but this is actually specifically tied to Medicaid itself. So whatever form of Medicaid your child has, then that mandate applies.
Thank you so much.
Thank you, Laraleigh. We really appreciate you being here virtually. We're sad you're not here in person, but we really appreciate your time today. I am just so excited to introduce our last speaker for today because I actually have the pleasure of working with her at the foundation as well as getting to know her a little bit more personally by being here with her this week. So please join me in welcoming Priscilla Hackstadt. She's a passionate advocate for the community and also another dedicated mother of someone with Phelan-McDermid syndrome. Her relentless efforts in everyday advocacy have significantly impacted her local community and beyond. So please join me in welcoming Priscilla. Thank you, Priscilla, for being here.
So actually, I'm like a baby advocate compared to the three women who went before me. Back in February, so I'm the finance director for the Phelan-McDermid syndrome, and so my boss is Ronnie, the CEO. And back in February, I had to cancel at the last minute a meeting with the finance committee, and it was because I was going to be interviewed for WSB TV, and they were going to talk about what was going on during Advocacy days. And I think that's how I got on this panel, because Ronnie was like, okay, it's all right if you cancel on us, but you have to speak with the other ladies. But like I said, I'm just the baby advocate, and so that means that I'm not going to take any more time up. You know, I think we have like less than 5 minutes. But basically, I'm here as an encouragement to anybody who is thinking about getting involved in the ways that these ladies have, either big or small, because I'm not a public speaker. I'm a numbers person. I'm an accountant, but I have a child who I really care about. His name is Christopher. He's 19 years old. And he's aging out of the school system in about 3 years. And Georgia, Laraleigh and I are both from Georgia, has a waiting list that is 7,000 people long for the Medicaid waiver. So that means that if the funding doesn't kick in for Christopher when he turns 22 and he's kicked out of the school system, that there's nothing for him. He has been on the waiting list for 9 years. So I just took the opportunity, and I think everybody in this room probably has the ability to get in contact with their Council on Developmental Disabilities and just take advantage of what's in place already. I sort of attached myself to their advocacy days, and specifically about the wait list in Georgia. And it was a fabulous experience. Went down to the Capitol. It meant that I had to navigate through Atlanta traffic and find a place to park, which is a little daunting when, you know, you're a work-at-home mom. So, and serendipitously, I guess, I ran into both my senator and my representative. I cornered them in the hallway, and I said, "This is my story. And let me tell you why it is so important that you guys think about this waiver list." So I'm just an encouragement. I'm going to have some questions for these ladies, especially Laraleigh, because we kind of are in the same neighborhood, about how to put things together better in terms of my advocacy efforts. But I'm encouraging every single one of you to look up your Council on Developmental Disabilities, and sometimes they have different names for it. You know, it's unfortunate that each state has different systems that you have to, I guess, unravel the red tape for. But I encourage every single one of you because, well, for example, there may be some issues. For example, mine was the waiting list in Georgia, that when you're looking into the future, this is going to really make an impact for your kiddo when they age out of the school system, when they're trying to navigate the waiver programs that might be available to them. And it also helps to get to know your state representatives and make sure that they know your face and your kiddo's face. So that's all. Mine is much, much shorter, but thanks for letting me talk and be a part of this.
I'm going to have Janet close this out with one quick thing, and then I know that these ladies are here and happy to answer any additional questions, and we're happy to connect you with Laraleigh if it was specific to her.
At some point, we will have, because I sent it on to the foundation, I have, and y'all have my cards, so if you want to email me, whatever, you can have my PowerPoint. I have the list of all the DDCO councils over the nation, and I've given it to the foundation. I've did some other resource lists about all the stuff that we talked about, and they'll be, at some point, will be on the foundation's website, or you can email me and I can send them straight to you. We're always open.
Thank you all. I want to thank Janet, Chrissy, Priscilla, and then Laraleigh for being here today and presenting and really sharing some valuable information with us all.